INI-CET isn't just about how much you have studied. It's about whether you can recall what matters the most when it matters the most. Endodontics in INI-CET isn't a memory test. It's a precision game. One missed apex, one missed generation, and the whole rank shifts. Hello students, I'm Dr. Sahil Dhingra from Team Meriters. I was All India Rank 1 in November INI-CET 2021. Today I will be guiding you all about the strategies and tips which I had used during my time to ace the cons endo subject for your upcoming INI-CET examination. Let's begin. First, we need to know the weightage of the cons endo subject. So the combined weightage of the cons and endo subject is roughly around 15 to 18 questions in your INI-CET, which is almost 9 to 10% of your 200 questions. So almost 10% of the paper is on cons and endo. Now among cons and endo, 70% of your questions would be from endodontics and only 30% would be from conservative dentistry, that is your cons. So roughly 12 to 13 questions would be from your endo and around 5 to 6 questions would be asked from conservative. Now, what all will be those topics or questions which are the most important? We will discuss in the subsequent slide. So, this is the broad syllabus of endodontics, which includes 8 chapters, starting from your anatomy of the pulp cavity to disease of pulp and periradicular tissues, biomechanics, followed by disinfection, obturation, bleaching, endodontic surgery, and dental trauma. And at last, the miscellaneous or the extra cover. Similarly, for your conservative dentistry, we have the principles of cavity preparation, followed by dental cements, amalgams, direct filling gold, composites, cast restorations, instrumentation, and the extra cover. Now, we'll see what are the most important topics and chapters for both. So, step 2 is the chapter-wise distribution. Now, first we'll talk about endodontics and then about conservative dentistry. When we talk about endodontics, the most important chapters are your anatomy of the pulp cavity, followed by your biomechanics, dental trauma or your traumatology, and the disinfection and obturation part. These 4 are the most important chapters. So let's see what are the important topics you have to cover in your endodontics. First, in the anatomy of the pulp cavity, in this chapter, most important thing is the classifications. At least 2 to 3 questions every year in your INI-CET are coming from these classifications. Now, in this, the important classification are your vertices, your Wien's classification for the root canal morphologies. Other than this, we have the Kim's classification for isthmus, classification for your apical constriction, so these classifications are one of the most important in this chapter. Second is the access cavity designs. So you have to know what is the access cavity design for a mandibular molar versus a maxillary molar. They will give you confusing options. For example, it is rhomboidal for a maxillary molar and trapezoidal or a rounded triangle for a mandibular molar. So they will give you confusing options. For example, in a, let's say they ask access cavity design for a mandibular molar. In that, they will give you both the options, trapezoid also and rounded triangle also. So when they are giving you both the options, you have to be specific. You have to go for trapezoidal. Whereas when they are giving you only rounded triangle and there is no trapezoidal, then you have to go for a rounded triangle. So these are the important things. Similarly, in a maxillary molar, they can give you both trapezoidal and rhomboidal to confuse you. So you must know which is the one for which category. Other than this, other than the access cavity, you also have the cross-sectional shapes. So what will be the cross-sectional design? For example, for the premolars, it is the elliptical design at the cross-section. These are the common questions they will ask from the anatomy of the pulp cavity. So most important here are your classifications, especially of the root canal configuration and your isthmus by Kim. Then is biomechanics. Now in biomechanics, everything is important, starting from your Schilder's objectives, the biological and mechanical objectives. They are very, very, very important. Other than this, the techniques. So they will ask you which of the following technique is used where, which is a apical to coronal technique, or which is a coronal to apical approach. So you must know everything about this. Then they will ask you about the classification of the NITI instruments, the NITI rotary, and the generations of endodontic instruments. The ISO classification is there from class 1 to 4, the groups 1 to 4. These classifications are very important. When it comes to endodontics, majority of things are there from the classifications only, because everything is self-explanatory after the classifications. In this NITI rotary, you have to know the newer generations in particular, because they can ask you from these, the article-based questions or something like that, from SAF, your self-adjusting files, the newer files like your Wave 1, Reciproc, TrueAnatomy, etc. So biomechanics is again a very important chapter. Then you have your dental trauma. Dental trauma, every year, every time we see the INI-CET, at least 4, 5, 6 questions are definitely there from this. Most important in dental trauma is the luxation injuries. Specifically, intrusion is asked quite often. And apart from the luxation injuries, there is avulsion. Avulsion is asked in pedo also and endo also, and it's very common question. They can ask you about the storage media. They can ask you about the extraoral dry time. What if the time is more than 60 minutes? Which drugs you will give, whether you will give doxycycline or not, things like that. Then again, classifications, again, very important here. A lot of times they ask simple questions like your Ellis classification. So there are 9 classes in this Ellis classification. They can ask you which is a class 4, very common question. So a non-vital tooth is a class 4. Similarly, which is a pediatric one. So a class 9 is pediatric. And likewise, they can ask uncomplicated and complicated fractures. Then other than this, we have the Anderson classification and the WHO one. All these are the important classifications for the dental trauma. Now, in dental trauma, other than this textbook reading, you also have to follow a few guidelines. So you have to read the IADT guidelines, the latest ones for dental trauma, and the AAE guidelines also. So these 2 guidelines you have to cover. Then we have disinfection and obturation. In disinfection and obturation, most important are the irrigation devices, and techniques. A lot of new irrigation techniques have come. We have the gentle wave system. Then we have something called as PIPs. So they will ask you what is the wavelength of the laser used in PIPs. Then apart from this, we have the type of syringes. This question, a lot of the students are confused. There are varying answers given everywhere, and this is asked often. In this, they will ask you side vent. Well, and another thing, they will ask you the gauge of the needle. How much you should keep it before. So it should not go beyond the apex. Again, obturation, disinfection, they can ask a lot of things. Then in this, they will ask you intracanal medicaments. Again, they will ask you things like triple antibiotic paste. What is the composition of this? Then newer irrigants like Qmix, MTAD, Etraclean. All these are very, very common questions in these parts. Then next is the obturation techniques. In obturation, they will ask, you need to know the ideal criteria for obturation, because many times they will ask you a question. They will tell you which of the following is not a ideal criteria for obturation. And then there will be one of the options like first discharge or something, weeping canal would be given. So you have to mark that option. So for this, you need to know what are the 5-6 requirements that when you can obturate a canal. Then the techniques. Most common now they are asking is the thermoplastic techniques. Which phase they will use? So alpha phase of gutta percha is used in the thermoplastic technique, a very common question. Then they will ask you questions like what is the percentage of shrinkage of the alpha phase? So it's 2%. So you have to do these MCQs very well, specifically for these thermoplastic techniques. And they will ask you the high heat techniques like your obturas, obtura 2 and 3. So this is the basic outline, what they will ask. Then they will ask few newer modalities like your vital pulse therapy. Vital pulse therapy is a very common question asked in your AIMS INI-CET examinations. In this, mainly they will ask on pulpotomy. Other than this, DPC, IPC are the common questions. For the vital pulse therapy, there is one article given in your by your ESC, the European Society of Endodontology, on management of the caries, deep caries and the exposed pulp. So in this, they will give you certain terminologies. What is selective caries excavation? What is stepwise caries excavation? So they will ask you these differences. For example, they will ask you a very common question being asked is what is the re-entry time for the stepwise excavation? So it is around 6 to 12 months. Now these figures are given by different authors, but you have to follow the ones which are highly followed, which are the most recommended. That is by your ESC, the European Society of Endodontology. So mostly you have to cover these topics in depth for your endodontics part. Then next is conservative dentistry. Now, when you see in conservative dentistry, the most important topics are your instrumentation, where you have to read about all the instruments, their instrument formula, what is the 4-digit formula, what is the 3-digit formula. Then second is your composites. Composites are the most important now. Earlier, they used to ask a lot of questions from amalgam, but from last 5-6 years now, amalgam has become totally obsolete. So they are asking no questions at all from your amalgams. So you can skip the amalgam part also. Then after this, you have the cast restorations. In this, most common questions being asked are the bevels and all. The types of bevels, partial bevel, long bevel, short bevel. And they will ask you the angles, what is the marginal metal angle for a cast inlay, for example. What is the cavo surface angle? So, and this for this, you have to read one table for comparing amalgam versus your inlay only. So in that, you will get around 10 to 12 differences in that table. Apart from this, there is not much other than we have dental caries, which is being asked a lot now. In dental caries, they can ask you newer things like your dyes, your caries activity tests. Then they can ask you the triad and the tetrad, the Kais triad and the Newbrun tetrad. But these are mostly things you would cover in other subjects. For example, in your public health, you will cover all these caries activity tests, the triad, the tetrad. In dental caries, they will ask one very important thing given in study band textbook. So in study band, you have low risk, moderate, and high risk. So how to manage these patients? In this, they will ask you what is the fluoride levels required, how much ppm of fluoride should be given for each, what are like after how many months we have to take the routine radiography or the routine follow-ups for a low risk, for a moderate, for a high risk. Most of the times they will ask you about the high risk, but sometimes they can also ask you that, okay, this modality is used for which of the category. Then they can give you options like low, moderate, high. So you need to learn the entire table in this. Now in composites, first let's talk about the composites. In composites, the most important are your classifications again. Then C factor is important. The etching and bonding. Specifically those 7 generations. So they will ask you simple questions, but you need to know this in detail. For example, they will ask you which is a smear layer dissolving or which is a total etch concept. They can ask you about the hybrid layer, which has the highest bond strength. So you need to learn these all 7 generations in detail with examples. Sometimes they will give you examples also and ask, okay, what is the feature of this part, or whether it is a single bottle or a multiple bottle or a self-etching system or a total etching system. So composites become very, very important. Then recently they are asking a lot on nano hybrid composites. Nano hybrid is a new trend. They will ask you questions like what is nano leakage. So these are the parts you have to know for sure. Then in the instrumentation aspect, mostly is the you need to know the formulas, the instrument formula for all, which is 3-digit, which is 4-digit. Very few instruments have a 4-digit formula like your GMT and angle formulas. Then they can ask you the principles or steps of cavity preparation in this. So in StudyMat, we have 9 steps, which is also you can find this in the Meritus app. When you solve the questions about the principles of cavity preparation, you will find the 9 steps of cavity preparation. The initial stages, 4 initial stages, followed by the 5 final stages. Sometimes what they will do is they will ask very simple questions, like they will ask you whether pulp protection is a final step or an initial step. Or they will give you which of the following is not an initial step, and then they will give you 4 options. You have to rule the odd one out. So these are simple questions. Then in cast restorations, they can ask bevels, flares. These two are most common questions. What is a primary difference between a primary and a secondary flare? The types of bevels, the partial bevel, long bevel, short bevel, which is the most commonly used bevel. So the long bevel is the most recommended one. Which bevel is given for cusp capping? Things like that. Then they will ask you the angles, your bevel angle or your cavo surface angle. This they will ask you. And then in this, they can also ask for your cast restorations. They can ask you the indications and contraindications. Similarly, they can ask in the cast restorations only, they will ask you difference between inlay, onlay, overlay. So you need to know about the various terminologies. A recent trend is there. They can ask what is an endo crown. So in an endo crown, you take retention from the pulp chamber. These are the broadly the main topics in your conservative dentistry. Then last topic, which is very important in cons, is the dental cements. Now in the dental cements, if you see, most of it will be covered with your dental materials. So ideally, you should try to cover with DM. When you read for the cements, impression materials, all these things which are common in prostho and cons endo, you can cover these in the DM aspect, in the dental material. So when it comes to the conservative part, mostly you have to focus on 4 chapters, starting from your composites, instrumentation, cast restorations, and in the instrumentation, you will have another chapter, principles of the cavity preparation, where you will talk about the resistance form, retention form, all those things. So this is the broad overview of the entire syllabus and what are the most important chapters and topics within those chapters for cons and endo. Step 3 is the past year INI-CET question papers. The minimum last 10 years, again, you have to cover. So around 20 papers. In that, you will get around 300, 400 questions from your cons endo, just from your cons endo itself in the last 20 papers. Then is the special question set in your tasks in your INI-CET Power Pack. This includes the image-based questions, questions from your recent articles, and the previous aims repeats. So these 3 things you will cover from the tasks in the Power Pack. And then you have to practice at least 2 to 3 times. The bonus tip here is to link with other subjects, specifically DM, and in endodontics, you can link with pediatric endodontics for your pulpotomy techniques, apexification, apexogenesis, and other such topics. Then in cons endo, what we see is around 8 to 10 line questions are given multiple times. So in those questions, the goal is to focus on the keywords. Once you can focus upon the keywords, you can derive to the conclusion quickly, and always search for the keywords first rather than reading the whole question from first line to last line. Because there are chances if you read the whole question, more chances of getting confused. But if you read the keywords, you can easily rule out the options. And last tip is that For the controversial questions, always follow the recommended guidelines like your IADT, the Dental Trauma Association, then American Association of Endodontics AAE, and the European Society, that is your ESE. Now, finally, I will tell you that how to start the subject, what all topics to cover in what flow. So for endodontics, if we see, most important is your anatomy of pulp cavity, biomechanics, disinfection, obturation, and your trauma. Apart from this, for the basics, you need to know the chapter on pulpal and periradicular diseases. This is also a part of oral medicine. So in this, you have to cover basically again another classification. So there is a terminology given by your AAE consensus. In this, they have given around 6 terminologies for pulpal diseases and 6 for periapical diseases. There they will tell you which one is having a tenderness on percussion, what is the vitality status of each, and what are the terminologies which are currently in use. So let's say they can ask you to rule the odd one out, that which of the following is not a terminology given by the AAE, and they will give you 4 options. So you have to learn this terminologies in the AAE consensus. This was given in 2009 by the AAE, and this is the one which is widely followed even until now. Then in pulpitis, there is a new classification, the Walters classification. So you have to read this classification for your pulpitis. Other than this, they will not ask much from these topics. In this, there is another aspect, the endodontic microbiology, which is important, where you have to read about the 4 zones of fish. What is the pathogenesis of your apical periodontitis? Pathogenesis for your AP. These are the only few topics which they will ask from this. It's a very theoretical topic, pulp and periradicular disease. In the bleaching, again, only the techniques. You just need to know which technique is used for vital, which is used for non-vital, what are indications, contraindications of bleaching, and what are the drawbacks, like a cervical resorption is seen in a vital tooth or a non-vital tooth, or periapical periodontitis is seen more commonly in a vital tooth, things like that. Then what you will do, what measures you will undertake, you have to give a calcium hydroxide slurry to prevent the risk of cervical resorption. So these are very basic questions. You just have to focus on the techniques. Once you know the techniques, then you can easily read the drawbacks, indications, and all. In endodontic surgery, not much is asked from this topic, other than there is one classification again of magnification. So they'll ask you what is the required magnification for carrying out the apicectomy procedure. So we have a classification of low, mid, and high range of magnification. So this classification goes like something like 2 to 6x, then 6 to 14x, then 14 to 26, more than 26. So biomechanics, anatomy, and disinfection, I have already told you, along with trauma, what all to read. In the extra cover, you will have the past repeats. That's it. Then in your conservative dentistry, the principles of cavity preparation, dental cements, composites, and your cast restorations. These are the most important, along with instrumentation. Again, the extra cover will include the past year papers. So when you are reading cons and endo, you have to start from these 4 or 5 important topics in both cons and endo. And then after that, the other topics which are more neglected, something like an amalgam or a direct filling gold. So these are not that important, because now these are all old concepts. The newer concepts are more about composites, cast restorations, the instrumentation techniques. When it comes to endo, trauma, VPT, these are the most commonly asked questions in AIMS. With this, we come to the end of this video. Hope you liked the video, and do follow us on Instagram and subscribe to our YouTube channel for more such content. If you have not yet downloaded the Meriters app, you can download it from the Play Store or the App Store. Thank you and all the best for your exams.